Okay, we offer all kinds of solutions, and we try not to just leave you with the problems. The solutions today have to do with you fellas out there and the ladies who take care of them. Prostate Solutions. Prostate Solutions of Arizona brings us Dr. Larry Bands, Board Certified Urologist. So, let's do definition. Prostate. This may not be too simple for a lot of folks that are watching. They hear the word, they have no idea what it is, where it is, or what it does.
Prostate is a gland that sits below the urinary bladder. We don't know all the functions of the prostate, but it does produce much of the fluid that's ejaculated in the semen. And it causes a lot of trouble as men get older, as it enlarges and can become malignant.
So there are still things that we are walking around with that medical science isn't necessarily sure why we're walking around with them.
Absolutely.
We know about the appendix, but I didn't realize that that was also applicable to the prostate. Tell us about caution signs and how we can stay out of trouble.
Well, you know, what's happening currently with the U.S. government is they've actually downgraded PSA screening. Most people have probably heard of PSA. It's called prostate specific antigen. It's a blood test.
That was what guys went in and asked for because people in media said go in and ask for the PSA.
Right. So the blood test has been around for over 25 years. If it's elevated, it may signify that someone has cancer of the prostate, but it's a non-specific test. They may have benign enlargement of the prostate. They may have infection or inflammation called prostatitis. And the job of a urologist is to sort that out and figure out who's at risk for cancer and whose elevated PSA is on a benign basis.
Well, is there anything else in addition? If the PSA doesn't have all of the answers, is there anything that does?
Physical examination is very important. It's called the DRE, digital rectal examination. If someone's doctor is not doing that in a certain age range for men and is not checking the PSA, I think people ought to inquire as to why and perhaps pursue that.
There are a lot of guys who just said, oh, he said it, digital, that's what the D stands for. And tragically, an awful lot of men, chickens that we are about going into getting getting checkups, they avoid it because they just simply say, no, maybe next year.
Correct, correct. Big mistake, in my opinion. I think it's a very important part of looking for and diagnosing cancers. The issue with prostate cancer is that even though most prostate cancer is slow growing and will not harm men as they age, there are still 30,000 deaths annually in this country from prostate cancer, making it the second leading cause of cancer death in men behind lung cancer.
Well, talk about the treatment. If you do find out that one of your patients has a malignancy, then what?
Well, if it's localized to the prostate and diagnosed early, treatment can range anywhere from just watching it, which we currently call active surveillance, to irradiating it, to removing it surgically, to freezing it, to heating it. There's many, many options. If it's advanced, if it's spread outside the prostate, those options are more limited, and sometimes hormone therapy, chemotherapy, immune therapy with the new prostate cancer vaccine may be helpful.
Now, you know what those same fellows want to know. They want to know if you have to remove the prostate surgically altogether, what kind of a life am I going to have?
Okay. Well, you're looking at someone who had it removed, and I have a totally normal life. Men do not ejaculate after they have the prostate removed, but they can still have normal sex, reach an orgasm, etc. There are some risks with surgery and some risks with radiation. On the surgical side, there's a small risk of incontinence and of erectile dysfunction. But nowadays, those things are well treated and oftentimes avoided with new surgical techniques.
So major strides have been made then in your field?
Very much so. Huge. In fact, in the last 3 or 4 years, there have been about 7 new drugs and treatments approved for prostate cancer. I think it's up there with melanoma as being one of the few cancers that has a lot of advances in recent years.
How early do I go in? At what age do I see my urologist? When do I do all of those personal prevention things?
Well, it's a very controversial point. It depends on a number of factors. Family history is important. If there's a strong family history, if your dad had prostate cancer or one of your brothers, probably my recommendation is to start at about age 40 and get a PSA blood test and an exam. The American Urological Association says screen between the ages of 54 and 69, but I think we're going to miss a window for people with aggressive cancers in their late 40s if we follow that. So I would say early 40s for an initial check, and then depending on circumstances, follow the advice of the expert.
If you don't have a urologist, go get one. This one is called Dr. Larry Bands, and you met him on the Morning Scramble.